Hey guys, it's Manual Monday, and today we're going to talk about treatment of patellofemoral pain. There was a recent study in JOSPT, systematic review actually, that indicated that manual therapy can be an effective approach to treating patellofemoral pain, at least in the short term. So we use it as a way to get people over the hump, or athletes that are just trying to get a little bit of an advantage, getting their pain better and getting back to their activity. So the study told us that in the short term, manual therapy directed at the patellar region is effective. The study showed that lumbopelvic interventions weren't necessarily effective, so we do try to focus in the knee area when we're doing our short-term interventions here. One technique you can do is a trigger point compression release to the VMO, amongst other techniques. This would be a technique we would use after some patellar mobilization. And so let's say I did some inferior and superior glides on Lindsay's patella, medial and lateral glides as well. Then I could go into some soft tissue treatment. The VMO trigger point is interesting distally because when I find a tender point or a trigger point here, that can actually refer to the front of the knee in the patellar area. So it's always worth checking, and it doesn't take very long to do. So the trigger point is most commonly found about 3 fingers superior and medial to the patellar border superiorly. So I can look for that trigger point here. Any tenderness in there, Lindsay?
Not too bad.
So what we're really looking for is a tender point compared to the other side, and definitely if it's reproducing symptoms on the front of the knee. So I can do trigger point compression if I did happen to find a trigger point. And I could hold that for about 90 seconds, or based on symptom response, if it's improving, I could continue to increase my depth. If you're certified in dry needling and your scope of practice allows, we could do that trigger point 3 fingers away from the superior medial border of the patella, inserting slightly inferior and diagonally. We could do a winding technique, or we could do pistoning if you choose to do it that way. But all those techniques are great ways to kind of clear out some of the soft tissue around the kneecap in patients with patellofemoral pain. We'll have the map of the trigger point on our Instagram page at Movementologists. Otherwise, we'll see you next week.